seems to be a lot of pitting doctors against patients and patients against doctors, right? And it's because both sides are equally frustrated with the system in which we're both operating inside of, right? The patients are saying, hey, my doctor only talked to me for 2 minutes. And the doctors are saying, I've got 50 patients on my schedule. How am I supposed to talk to these patients for more than 2 minutes?
Dr. Erin Nance, welcome to the Lindsay Elmore Show.
Thanks, Lindsay, so much for having me.
I'm so excited to talk to you. We're going to be talking about how you went from an orthopedic surgeon to looking behind the scenes in the highs, the lows, and the ethical gray zones that are modern medicine. You're known for your TikTok account, and I would love to know more about Little Miss Diagnosed. And so let's dive in and just get to some talking points and just really learning more about who you are, what brought you here, why you decided that this was so important for patients. And so people have called you the real life Meredith Grey. How do you feel about the comparison, and in what ways do you think that it is accurate, and in what ways do you think that it is romanticized?
It's a great question. Online, I'm known as the medical storyteller, and I really got my start by sharing stories about what my life was like as a young woman in orthopedic surgery in New York City. And the very first story I ever told was the story of my first day of work. And I had wanted to be an orthopedic surgeon my whole life. Okay, I had been preparing for this moment, and I'm starting on night shift. It's July 4th weekend, and the very first call I get is not about a patient. It's from my mom. I'm like, Mom, what are you doing? I'm at work, right? It's my first day. Like, I got it. I'm good. I don't need to drink more water.
Yeah.
But it was actually my mom calling to tell me that my brother had been in a diving accident and he had broken his neck and become a quadriplegic. So what was unexpected was that my first patient was actually my family member. And the book really goes into how that family tragedy shaped me as a doctor. And I think it gets to your point about how or why people may refer to me as, Meredith Grey. I think I have just a tremendous amount of empathy for patients because I was on that other side so early on in my career, right? I know how important it is, the communication aspect, right? And don't get me wrong, I'm an orthopedic surgeon, right? I'm doing rounds at 5 a.m. when everyone is asleep. But I know those patients and the patient family, they are waiting with bated breath for that 1 minute when they catch the doctor, right?
Yeah.
In between rounds and everything.
Oh, yes.
So for me, I always bring it back to how would I like to be treated as a patient, as part of a patient's family unit. And that's, I think what grounds me as a doctor.
Mm-hmm, mm-hmm. How do you want to be treated as a patient?
As a patient, you want to be treated like someone who's been seen, right? Someone who's been heard. And I think there's a lot of back and forth right now, especially online. On my, what I see on TikTok is it seems to be a lot of pitting doctors against patients and patients against doctors, right? And it's because both sides are equally frustrated with the system in which we're both operating inside of, right? The patients are saying, hey, my doctor only talked to me for 2 minutes. And the doctors are saying, I've got 50 patients on my schedule. How am I supposed to talk to these patients for more than 2 minutes?
Right. I have 3 minutes max to be able to bill and to get them in and out the door and on to the next one.
Correct. So I think it's about bringing these two sides together. And what I really think that my account is doing is that it is bridging that gap between the doctor and the patient outside of the office setting.
Tell us about your organization and why you decided to start it. What are your missions and visions, and what do you bring to patients?
I think what I was noticing online was that there were a lot of great doctors on the platform giving incredible educational, content, disease awareness, but the platforms themselves are untrustworthy, right? I mean, medical misinformation is probably the most dangerous part of healthcare. And I will tell you, I'm in a society for New York State surgeons. Medical misinformation online is their number one concern and complaint. Okay. Bigger problem than insurance, getting, reimbursement from insurance or, malpractice. It's medical misinformation. And what I did was built a platform. It's not even publicly launched yet, but the whole plan is to be a safe and trusted place for patients to understand that the content on this platform called Feel Better, BETR, is from credible, verified sources. Because nowadays, it's almost impossible to understand who is who, what's real, what's AI, right? What are the motives behind the people giving these recommendations, making these, product recommendations. So I really lean into the medical education and community support.
I mean, I think that the education as well as the purchasing through affiliate links of different devices and supplements and things like that, it used to be something very, very common and everybody did it. Now, there are a lot of people who just say, I'm not going to go out there and get this, that, or the other, but they go to the grocery store and the products are absolutely terrible. And so there is this push and pull between, do I go an affiliate direction where I got to get everything online? Do I go to my local grocery store? Do I go to a local pharmacy, which is even going to have a different brand? Orthopedic surgery is not necessarily where we think about going and saying, I'm going to come up with this big, not just supplement, but also like medical gadget routine that's going to help keep my joints healthy. But if patients are going out there to do that, and we've got so many misdiagnoses all over the place, how do you encourage people to kind of untangle those things to where they can get the supplements, the education, the surgical care that they need, while also not getting $1,000 worth of supplements that are just not going to be helpful for them?
I think, as I said before, you have to consider the source of the content.
Uh-huh.
And I am a true believer that patient experience is just as valuable as the medical expertise. If you're a woman with endometriosis, there's no one you trust more than another woman with endometriosis, okay? So I think we have to have this balance of, you want the doctor to be the one to say, yes, this is a safe product, right? This is something that I recommend for my patients in my office. But at the same time, I'm not the one who has carpal tunnel.
Mm-hmm.
I don't have a migraine. So I think it puts a lot of onus on the individual to do kind of their homework, to do their research. And where I think really the dangerous part comes into play is, especially for things like supplements, right? There are tangible harms, okay, that can happen, side effects can happen.
Sure.
When these medications or supplements are taken without the supervision of someone. And so this is even speaks to the larger called direct-to-consumer movement of pharmaceuticals, right? Now, how many commercials did you see online about Ozempic and Wegovy where you're not even going to a doctor to talk about these things, right? And this has been happening for years now with Viagra, with hair loss medications. This movement, there has been a blurring of the lines between medicine and wellness. And you have the wellness population creeping into the medical field. And then you have the medical field also creeping into what was traditionally wellness, right? Your Mark Hymans and, all those types of doctors. Casey Means, who's now going to be our Secretary General or General Secretary, whoever's the highest
Surgeon
position in the
General.
land. Surgeon General.
There we go.
So listen, I don't necessarily think that one side is right or wrong.
Right.
But I do encourage people to research the source, question the motive behind the information, and make an informed decision for yourself.
Yeah. Yeah. Making informed decisions can be really hard if you're facing any kind of financial insecurity when it comes to healthcare. And I also find that when it comes to misdiagnoses, and as we're looking at, different ways that patients are treated within our system, homelessness, addiction, having to use kind of SNAP benefits or governmental assistance to access medications, this really changes how we heal, and it changes things medically, it changes things emotionally. What are your thoughts on how we maintain humanity within medicine, knowing that, misdiagnoses are out there everywhere that are costing people money that they may or may not have?
So I'm the co-host of a podcast called The Medical Detectives, where we have a patient on every week share their story about their journey, about how they've been misdiagnosed. It's kind of like a Dateline meets Grey's Anatomy. And every time the patient has been through an odyssey where, because of the, frankly, bias of the physicians who have been treating them, that has been a barrier for them to get the right diagnosis, the right treatment. Okay, you talk about addiction. We had a patient, it was actually the patient's wife told the story, how he had a history of substance abuse. And every time he went to the ER complaining about pain, they just immediately said, you categorized him as you're a drug seeker. And in the end, I don't even remember, he might have had cancer or something. He had a physical medical problem behind it. And so a lot of it is, on the physician side, we have to understand that whether it's conscious or unconscious bias exists, all right, when we are treating our patients. And we cannot ignore the fact that there are hardcore data, right? If you are a mother or a pregnant woman and you are Black, you are 30% more likely to die after giving birth to a child,
right,
compared to women.
Oh, yeah,
white women,
absolutely.
Okay? So this goes back to, again, the bias that the system has for certain groups. And the best thing that I can tell, the individual patients is you have to protect yourself and be on the lookout for yourself, and understand that many times this is not a, conscious decision that doctors are doing. They're putting you into their box. But I do say you do want to speak up. You want to, no one is going to care about your condition more than you. And the hardest thing to do is to learn to form a partnership with your physician.
If someone listening has never really, they've been in healthcare, but they've never really worked on, like, do I really have bias? And if I do, in what way? Because, I think racial bias, people talk about it. Gender bias, people talk about it. But you think about medication dispensing bias, where, some pharmacists will feel fully confident to dispense medication A, but the other pharmacist is like, no way, I'm not doing it. And that can be very stressful for a patient. And so I don't want the bias discussion to go in a, sunshine and rainbows and, daydreams about what it is. But how do we bring it down to earth, get people to look inside and go like, ugh, I was raised in this particular area where there was this demographic, which led me to have these beliefs. Here's how that impacts my practice today. How do we change this and shift our biases to where we're genuinely taking care of patients? We're not going to get rid of the biases, but we're genuinely taking care of patients. How do we shift to that point in a way that, like I said, is really down to earth and really grounded, and not something that just is kind of like woo-woo?
Yeah, I mean, I'll give you a quick example. One of the chapters of my book, I talk about when I was a medical student, there was a young woman. She had just had a baby and she was admitted to the psych ward.
Yeah.
This woman wore a J. Crew cardigan. She had her hair in a braid. She looked more put together than I did. Okay?
Right.
And I'm like, what is this woman doing in the psych ward? Okay, she's reading Jane Austen. Okay, what is going on? And I was like, there's nothing wrong with this lady. Okay, like I'm like, you guys got it wrong. And it wasn't until months later, I was off the rotation and I go to the grocery store and I see her picture on the cover of a tabloid magazine. She had eloped or escaped from the hospital, and she had gone into full-blown postpartum psychosis, schizophrenia break. And I really had to step back and be like, why did I how did I get this so wrong? And I had to acknowledge that I had bias in a different way, right? Like I was giving her too much credit because I thought, well, she looked like me. She acted like me. I'm not crazy, right? So I think it's sometimes you have to be confronted with it, like black and white, like right in front of your face with that, magazine staring at you in the face. Those moments are going to be few and far between. But listen, we really have to just take a good deep dive into our practices, right? The patterns that we're doing. Why are, same thing going back to, Black mortality rate in maternal, postpartum period. Black women are also way more likely to get C-sections than white women.
No.
Well, why is that? Right? This is a systemic pattern. It isn't just one small area of the country. This is across the country. So sometimes, yes, it's hard to call out the individuals, right? And say, like, Dr. Nance, are you prescribing equitably or whatnot? And I think we have to look at it in terms of a large system matter, and then do the internal look and say, okay, like, let me see, am I really doing this pattern also?
Mm-hmm. Mm-hmm. So let's take these same ideas about prescribing and being sure that we're really looking at the patient as a person as we prescribe for them. We also need to look at the operating room as a place that is staffed with human beings. It is a male-dominant space, and there are a lot of young, fresh out of medical school residents that are coming in to the operating room. How do you encourage women to enter these male-dominated spaces, and what is something that you wish that you had known earlier in your career?
My field is 94% male. Okay, it's been 94% male for over 50 years. There has literally been no needle change. Although I will say there is a higher percentage of women trainees, but they don't stick around. And well, why is that? Right? Well, there's zero support for what it also means to be a woman in her 20s and 30s. In my residency, if I wanted to have a child, I could only take off 2 weeks, or else I would have to repeat the entire year of residency. All right?
Which is absurd.
Is that compatible with starting a family? No. All right. So things have changed a little bit in that way, but it took a generation of my female colleagues to say, that's not okay. I don't want a young woman who's going into medicine. Listen, I used to work 36 hours straight. I would not have a drop of water. People say, oh, I never went to the bathroom. I go, well, if you're not drinking any water, you don't have to go to the bathroom, okay? I don't want my trainees coming home with their lips cracked and bleeding because they were too busy. They could not even take a sip of water, which I'm not exaggerating. Okay, this was my life.
Sure.
So I think we have gotten away from the generation who said, well, I did it this way, so you have to do it this way. And really, we encourage safer practices for residents.
Right.
I want there to be better mental health support. One of the great things about having more, I would say, NPs and PAs as part of the care team is that not all of the responsibility is falling onto these junior residents, these young doctors, and that we do have more support in other areas. So yeah, I think, you gotta be in it to win it. So you gotta put yourself, there. You gotta get there. You gotta do the work. You have to know why you're there, and when you're there, take your shot. Right? Don't be a wallflower. Speak your mind. Answer the questions. Ask questions.
Right. Asking those questions to really get into what does it mean to really work in medicine, in nursing, in pharmacy, and really what is the integration of all of those points. And the reason that we do it is because we're there to take care of patients. We're there to help them live either their best life and they're going out there and about to go run a marathon, or we're helping them to live their best life as they're approaching maybe the end of life. And that leads to some pretty heartbreaking stories that we work with within the hospital. What are some of the stories that have kind of broken you open, changed the way that you really feel about healing and the importance of emotions within healing, and really how do you use those patient stories when the going gets tough and maybe there's some jerk in the operating room who is kind of bossing you around saying, I'm the dude, whatever is going on in the day. What are some of your favorite patient stories? What ethical dilemmas do they teach us? And how do they keep you going throughout the day?
Well, my most recent viral story on TikTok, which was also another one of the chapters in Little Misdiagnosed, was about the time I was actually a fellow, and a construction worker had fallen 8 stories and he had almost taken off his hand.
Hate.
I mean, almost a full amputation.
Yeah, hate.
He came to the ER, but wouldn't give his name and ended up leaving before we ever treated him. And I said, what is going on? He's going to die. And he's literally going to die if he doesn't get this taken care of. So I went to the construction site, which is across the street from the hospital. And I'm like, what's going on? Like, why did this guy run away? And someone came up to me and said, he's terrified. He's undocumented, and he's terrified that he's going to, be deported. And which is an absolutely real fear. And what I ended up doing was finding a way to admit him under a John Doe name and doing the surgery and trying my best to decrease those chances of something like that bad happening. I couldn't guarantee that, something like that wouldn't happen. But I just felt this man did not deserve to die because he was worried about being sent home from this country. And I told this story really not to describe how I'm a hero, but to describe how I'm a human, right? I think anyone in that situation would also realize, okay, there was risk to myself, risk to the attending to do something like that, legally. But in the end, I just brought it back to, this is a human, this is a person. What can we do to help him?
Yeah, absolutely. I mean, it is so important for us to remember these patients are people, The patients are absolutely people. And when we dehumanize people throughout the system, it really puts not only the patient at risk, but our own humanity as well. So, well, Erin, it has been such a joy to get to talk to you about Little Miss Diagnosed, all about how you have taken your trailblazing orthopedic surgeon career and turned it into a viral TikTok sensation that helps to pull back the curtain on the high-pressure world of modern medicine. And you also have a debut essay collection called Little Miss Diagnosed. Listeners, you can find out more about Erin and the work that she does at nancemd.com, as well as on the Instagram and Facebook handle, as well as Twitter handle, littlemissdiagnosed.com. I don't have your TikTok here in front of me. Is it the same handle there?
So the TikTok handle is Little Miss Diagnosed. On Instagram and Facebook, I believe it's Dr. Erin Nance. I have so many scam accounts of me that are out there. There's actually a Facebook account of over 100,000 people and a YouTube account with 70,000 people. It's not me. It's my content that I create. I really am only on TikTok. That is where my main, content comes from. But I have started, reposting at Dr. Erin Nance on Instagram and Facebook.
And TikTok is Erin Nance.
TikTok is Little Miss Diagnosed.
Okay.
Yes.
All right. Listeners, go and check out all of Erin's content over on TikTok. It is Little Miss Diagnosed, and you can find out all of the ethical dilemmas that go into the modern practice of medicine and find out what it means to be a real-life Meredith Grey. Dr. Erin Nance, thank you so much for coming in today and being a guest on The Lindsay Elmore Show.
Thank you, Lindsay. It was a pleasure.